Hello everyone. In this video, I will discuss with you the topic how to remember the motor nerve supply of the head and neck region easily and effectively. I am Dr. Rubaiyat Jahan, MS Anatomy. We all know that out of the 12 cranial nerves, olfactory, optic, and vestibulocochlear, these three are purely sensory nerve. Oculomotor, trochlear, abducent, accessory, and hypoglossal, these are purely motor nerve. And at last, trigeminal, facial, glossopharyngeal, and vagus, these are mixed nerve. That is, they have both motor and sensory component. So there are 9 nerves which have the motor components, and except vagus, the other cranial nerve supplies only in the head and neck region. Now, if we see the major viscera in the head and neck region are tongue, soft palate, pharynx, and larynx. The major muscles group in the head and neck region are muscles of the face, muscles of the mastication, extraocular muscles. As we see that the 9 nerves having the motor component, so that 9 nerves will give the motor supply to this viscera and this muscles group. Now come to the topic, how can we easily remember the motor nerve supply of this viscera and muscle group? To remember this motor nerve supply easily and effectively, in this video we will go through this viscera and muscle group one by one. The first viscera is tongue. We all know that all the intrinsic and extrinsic muscles of the tongue are supplied by the hypoglossal nerve, that is 12th cranial nerve, except the palatoglossus muscle, which is the muscles of the tongue, but it is supplied by the vagus nerve. But why this thing happened? Because during the development, all the muscles of the tongue are derived from the occipital myotome, and nerve of the occipital myotome is hypoglossal nerve. So the muscles of the tongue, as they are developed from the occipital myotome, they are also supplied by the hypoglossal nerve. But the palatoglossus muscles, it is originated from the palatine aponeurosis of the soft palate, and we all know that the nerve supply of the soft palate is the vagus nerve. So this muscle is also get its nerve supply from the vagus nerve. Our second viscera is soft palate, and all the muscles of the soft palate are supplied by the vagus nerve, that is 10th cranial nerve via the pharyngeal plexus, except the tensor veli palatini muscle. It is the muscles of the soft palate, but it is supplied by the mandibular nerve, which is the branch of the trigeminal nerve. Again, the why the tensor veli palatini muscle get a different nerve supply, because the tensor veli palatini muscle is developed from the first pharyngeal arch, and we all know that the nerve of the first pharyngeal arch is the mandibular division of the trigeminal nerve. That's why it gets its nerve supply from the mandibular division of the trigeminal nerve. Now come to the viscera pharynx. We all know that all the muscles of the pharynx are supplied by the vagus nerve, that is 10th cranial nerve, except the stylopharyngeus muscle, which is supplied by the glossopharyngeal nerve. But why? Why this happened? Because the stylopharyngeus muscle is developed from the third pharyngeal arch, and we all know that the nerve of the third pharyngeal arch is the glossopharyngeal nerve, that is 9th cranial nerve, and this the muscle and the stylopharyngeus muscle and the glossopharyngeal nerve also lies very close proximity to each other. After the pharynx, we will go for the larynx. All the intrinsic muscles of the larynx are supplied by the recurrent laryngeal nerve except the cricothyroid muscle, which is supplied by the superior laryngeal nerve. The recurrent laryngeal nerve and the superior laryngeal nerve both are the branches of the vagus nerve. But why the cricothyroid muscle get a different nerve supply? Because all the intrinsic muscles of the larynx are derived from the sixth pharyngeal arch, and the nerve of the sixth pharyngeal arch is recurrent laryngeal nerve, but the cricothyroid muscle, only one muscle of the larynx, is developed from the fourth pharyngeal arch, and the nerve of the fourth pharyngeal arch is the superior laryngeal nerve. So this cricothyroid muscle get its motor supply from the superior laryngeal nerve. The motor supply of the viscera are completed. Now come to the muscle group. At first, muscles of the face. All the muscles of the face are supplied by the facial nerve except the masseter muscle, which is supplied by the mandibular nerve, and we all know that the mandibular nerve is a branch of the trigeminal nerve. Now come to the point why the masseter having a different nerve supply. Because all the muscles of the facial expression are derived from the second pharyngeal arch, and the nerve of the second pharyngeal arch is the facial nerve, that is seventh cranial nerve. And the masseter muscle, though it lies in the face, but it is not a muscle of facial expression. Rather, it is a muscle of mastication, and they are developed, the muscles of mastication are developed from the first pharyngeal arch, and they are supplied by the mandibular division of the trigeminal nerve, because the nerve of the first pharyngeal arch is the mandibular division of the trigeminal nerve. We already knew about the muscles of the mastication. All the muscles of the mastication are developed from the first pharyngeal arch. So they are supplied by the mandibular nerve, which is a branch of the trigeminal nerve. Oh, there is no exception. So it is a very much relief. Our last muscle group is extraocular muscle. All the extraocular muscles are supplied by the oculomotor nerve except the superior oblique muscle, which is supplied by the trochlear nerve, and the lateral rectus muscle, which is supplied by the abducens nerve. Answer of the different nerve supply of the extraocular muscle lies in their development. By the beginning of the third week, the paraxial mesoderm is segmented, and these segmented mesoderm are called the somatomere. There are 7 somatomere, and from which the head musculature as well as the extraocular muscles are derived. So, all the extraocular muscles are derived from the somatomere 1 and 2, and the nerve of the somatomere 1 and 2 is oculomotor nerve, that is third cranial nerve, and the superior oblique muscle, which is developed from the somatomere 3, and the nerve of the somatomere 3 is trochlear nerve, and last the lateral rectus muscle, which is developed from the somatomere 5, and the nerve of the somatomere 5 is the abducens nerve. These are my references. You can go through this and you will get more information. Thank you all.